Hey y'all, this is Anya at DecoToes. Welcome back. Oh my goodness, it's been a long time. It's been a long time. I think the last video that I have posted was like 2 months ago. So I've been planning on making this video for a long time now, and I apologize for taking so long. And the main purpose of this video is to give you an update on how I am doing after my knee replacement surgery. So if you're interested in hearing all about that, keep on watching. So first of all, if you haven't seen the last video that I posted, I will link it down below. So I've done a video the day of my surgery and right after, and then I filmed something within a few days after the surgery. Let me tell you this, the first week after the surgery is a complete blur. I mean, I was literally drugged for the first week without realizing it. What happened was I was prescribed a few medication. One of them was for nerve pain. It's called Lyrica, and it had side effects, all of which I was experiencing, but I never really read the bottles. Maybe I should, huh? Anyways, after a week, I was like, something is wrong. I feel like, I don't know if it was the anesthesia that was giving me these effects that are not going away or what it is. But basically, after reading the possible side effects of Lyrica, it was blurred vision, it was drowsiness and dizziness and all of that. I was completely out of it. I don't remember the majority of that first week, and that is when I posted the last video, so I don't remember much of it. Let's just say that. I might have mentioned in that video that when it comes to the pain that I experienced right after the surgery, I mean, granted, I wasn't doing physical therapy. My knee was immobilized because of the way they had to cut into my knee. So normally they cut right smack in the middle in front of the knee, and they open the knee kind of like a book to get to the kneecap and the whole joint itself. Because of my pre-existing scar that I had on the outside of my leg, my doctor decided to go along that scar and fix it a little bit. It was a really nasty scar from the pins that I had along that line from the leg lengthening. So I'm very grateful that he was willing to do that, because the scar does look a whole lot better now, which I will show you a picture of right over here. So as you can see, I mean, I've given you somewhat of a visual of what the scar looked like when I still had the glue all over it and the dry blood and all of that. I mean, it is looking fantastic as of right now. It got really flat and all of that. But anyways, getting to the point, because they had to open me up from the outside and then open everything all the way to the right side of my knee, up to the inside, to move the kneecap out of the way to then replace the knee joint. It was a lot of moving of the soft tissue and everything. So that's why my knee was immobilized for the first 2 weeks. Now, with that being said, I did only take, I'm going to say 3 or 4 oxycodones after the surgery. And after that, I wasn't taking any pain pills whatsoever. Not even like regular Tylenol, Advil, whatever. I felt great. Amazing. So for those 2 first weeks, my knee was immobilized. I couldn't bend it at all. And then after 2 weeks, the first day when I was able to take the knee mobilizer off and bend the knee, I tried bending the knee on my own. I barely get any bend. The next day I went to physical therapy for the first time. I got 25 degrees. I think I was doing physical therapy 3 times a week. I mean, we were making progress, but the progress wasn't as good as it should have been. And it's because of all the scar tissue that I have in that knee from all the previous surgeries. I mean, just on my leg alone, I probably had about 15 surgeries in my life. So there's a lot of scars, and there's a lot of scar tissue inside. And because of all that history, the knee just wasn't moving. It wasn't the knee joint that was the problem, it was everything around it that caused that problem. So I saw a doctor a month after the surgery. At that point, he scheduled another appointment pretty soon after that, like a month later or something. And basically, if I wasn't making enough progress with the knee bend, then we faced the possibility of having a knee manipulation. And for those who don't know what that is, basically you go into the hospital as an outpatient and you go through a procedure where they put you under general anesthesia and they force bend the knee for you. They do it gradually and slowly, but eventually putting, I'm guessing, quite a lot of force into it. So I go in a month later and I basically told him how I feel about it. I was terrified of having the knee manipulation and being put under again and all of that. But I also knew that this was my only chance to get this knee to bend more than I was bending it before. And it's important because I use my legs all the time. And so that knee function and the mobility is everything to me. So I was willing to go through that. So he agreed that it's a good idea to do the knee manipulation. And so I saw him on Thursday. We scheduled it for the following Tuesday. That was 2 weeks ago. And let me tell you this, as terrified as I was of doing that, I woke up from the procedure, which I don't even know if you can call it that. I mean, they didn't cut into me or anything, but I woke up and yes, I was in pain, but that evening, after I suffered through the headaches and the feeling nauseous and all of that, I mean, I slept pretty much the whole day. But at the end of the day, I tried to bend my knee and I bent it more than I expected. I don't know exactly what that number was, but the difference right after the manipulation as opposed to right before the manipulation was just night and day. I mean, I could not believe it. I was just so happy, so happy. So the next day I had physical therapy and it just was going so good. It was going so good and it still is going so good. So what I'm trying to say is that because of everything, how tight everything was in there, I mean, my quad, my everything was so tight and prevented my knee from bending that after he manipulated it, it just like everything, he broke through everything loosened up, and it was definitely one of the best decisions I could have made regarding this knee. So we are now 2 weeks after the knee manipulation and 2.5 months after my knee replacement. As you know from the previous video, if you watched them, I was really terrified of having a knee replacement and I was putting it off for a long time. And I can tell you now that I wish I would have done it sooner because I have been dealing with this horrible pain from the arthritis in my knee for such a long time. And yes, it's unusual because I am still so young and dealing with arthritis. I mean, I feel so good now. I am still not nowhere being at 100% of recovery, but I am already feeling so much better than I did before I had this surgery. So I am absolutely thrilled. Now I am going to pop pictures of my x-rays, the before and the after, because I think it's really just fascinating how they do it and everything. So this is the before, and as you can see, they drew the lines showing just how crooked my leg was. I mean, the femur and the bottom of my leg were not in a straight line at all, as you can see. Now compare that to this after picture. I mean, my leg is super straight now and I'm thrilled about that because it actually did lengthen my leg quite a bit. I used to wear a lift under my shoe that was about 2 inches. Now granted, I'm the one who decided how high the lift should be, so maybe it was too high, but now it's less than 3/8 of an inch. So now I have to remake all my shoes but it's totally worth it. Also, I did want to mention that my huge fear was that rod that I have in my femur. And I was afraid that it was going to have to be taken out, and that then I put myself at the risk of my femur breaking. Which, as you see, I mean, the knee is replaced and the rod is still there. And I am so thankful to my wonderful doctor. I mean, I can go on and on and on about how amazing my doctor is, and I really couldn't have found a better one. I'm just thrilled that he was able to do the surgery for me, and just his overall care of his patients and his skill and expertise. I mean, amazing doctor. He did have to shorten the rod a little bit just for the knee replacement to be possible, but that is fine. My femur is still stable and my knee is replaced and it's feeling amazing. And I'm not gonna go too much longer about this because I mean this video is going to be way too long of me rambling on and on and on, but this video is for those who are actually interested in the whole process and how I'm doing right now. So yesterday, I am still doing physical therapy 3 to 4 times a week. I actually go to 2 different places. The first place that I go to 3 times a week, most of the weeks, is let's say mainstream, and then I go privately to a different place that does a whole lot more hands-on and individual, and they do such an amazing job with me, and I'm so grateful that I can go there and so appreciative of all their help. I have made a monumental progress yesterday. So one of the exercises that I do is I go on the bike, and so far I was only able to kind of rock back and forth because I wasn't able to make the full revolution. Well, yesterday I sat on a bike at physical therapy and I made it all the way through. All the way through. So, I mean, I was ecstatic, okay? Ecstatic. So, what happened then is I was sitting at home and I was like, well, I've tried to ride my bike a few days ago, a week ago, I'm not sure when, and I could almost get it all the way around, but not quite. So I said, well, if I did it in physical therapy, maybe, just maybe, I could ride my bike now. So I got on it, and here's what happened. Y'all, I am back on the bike and riding it better than ever before, and I cannot tell you how excited I am. I mean, this is huge. This is huge. And I feel no pain in my knee. And okay, so at this point, I'm at about 100 degrees of a bend in my knee, which I'm pretty sure that before the surgery, I was at about 75, 80. I was not getting to 90 degrees. So I'm bending my knee more than I did before the surgery. I'm walking without pain in my knee. I can go up the stairs, alternating legs, without pain in my knee. I'm just so thrilled. This is amazing. I am so extremely happy. And obviously I am continuing physical therapy. For how long? We don't know how long. Part of it is the mobility in my knee. Another part is strengthening my leg because my left leg is a whole lot weaker than my right leg, and it makes walking difficult, and I limp a little, well, quite a lot actually. So all of that is stuff that I am working on in physical therapy, and I'm doing exercises at home to help. And so they say that full recovery from a joint replacement is about a year. So I've still got a long way to go. And if this is how I'm feeling 2.5 months after the surgery, I cannot wait to see what I feel like next June. Also, I wanted to make a quick mention that the videos that I'll be posting from now on will not be regular, just because of how much physical therapy I am doing, and just a bunch of other things that I'm doing. I've started painting again, and I really want to put my time and effort into that, and just really growing in that department, and just putting a lot of practice into that. So, but I will be making more videos. If you don't want to miss any future videos, considering that they will not be posted regularly, consider subscribing if you haven't already done so. And also consider hitting the bell so that you are notified every time I do post a new video. And I want to end this video on this note. If you've seen the previous videos, you know that my cousin came here from Poland to help me out. And I just wanted to say a huge, 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 huge thank you to her. Thank you so much for being here and for helping me. She has done an amazing job. I mean, the way she took care of me. I am stubborn. I wanted to get into being independent as much as I could, as soon as I could. But she just did wonderful, and everything that she went through with me in the hospital, and just the way she took care of me was absolutely amazing. And I absolutely loved having her here. And let me tell you that when she left, I cried. I cried a lot, and I still get emotional thinking about the fact that she's not here anymore. It was nice having family here. We don't get that often, so I'm just very grateful. We had the best time ever. I mean, we went to a lot of places. We've done a lot of things. We have really made good use of our time. I mean, as soon as I was able to get up out of bed and get into a wheelchair, we would get in the car and I would get in the wheelchair and she'd push me around, and there was no stopping us. So I'm very grateful for the wonderful time that we had together. And on that note, you guys, thank you so much for watching here. If you are still here and supporting this channel and watching my videos, thank you so much. And I'm sorry that you had to wait so long for this one, but I will see you again soon. Bye.